Hello, and thank you for joining us tonight for our free webinar, Cosmetic Facial Acupuncture, Managing Patient Expectations, Communication, and Increasing Retention, featuring Dr. Shellie Goldstein. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speaker, please make sure to use the Questions tab to the right of Chat. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with the link to view the video on demand and a copy of the slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speaker. Dr. Shellie Goldstein is widely considered one of the worldwide experts on cosmetic facial acupuncture. She is the author of the Your Best Face Now, Look Younger in 20 Days with the Do-It-Yourself Acupressure Facelift, and she's the creator of Touch and Glow, the Do-It-Yourself Acupressure Facelift Kit. As a leading authority and educator of cosmetic facial acupuncture, Dr. Goldstein founded the Academy of Advanced Cosmetic Facial Acupuncture, which has recently partnered with the Pacific College of Health and Science to present the Facial Applications for Cosmetic Enhancement Training Program, aka the FACE program. She has been featured on major television and cable networks in the press, and she's also a columnist for Acupuncture Today. Please join me in welcoming Dr. Shellie Goldstein.
Hi, everyone. How are you? Yes, so today we are going to talk about managing expectations, improving communication, and enhancing patient retention, particularly as it applies to cosmetic facial acupuncture. It is definitely my specialty. It's something that I've been doing for almost 30 years. And I know that when I first started practicing, I was new and was so focused on the points. What point should I be using? Am I going to get the right treatment results? And on some level, the concept of managing expectations, improving communication in order to enhance patient retention wasn't really in my consciousness. But in fact, it's extraordinarily important, and many of us naturally do it, and some have to learn it. So today, for those of you who are naturals, I want to hear more about your experience at the end. And for those of us who are maybe new to practice or just trying to figure it out, I hope that a lot of this information will be really helpful for you, because there are so many people out there that are interested in acupuncture and cosmetic facial acupuncture. And as a representative, you being the representative of our profession, it's really important to be the best that we can be on so many different levels. So according to a 2020 marketing strategist report, the average business will lose around 20% of its customers from failing to maintain relationships. Does that sound like a lot to you? It does. I mean, it's a significant amount, 20%. And I know that when I am in a store and shopping, if I'm not treated with the kind of respect, or if I'm not treated, people are mean to me, the people who run the store, I probably won't come back. Maybe if I love the clothes or something like that, I might come back once and give it another try. But for the most part, it's really important. Your environment and the people that you encounter really do help to create the milieu of your treatment, or of everything, particularly your treatment. So when we are talking about maintaining expectations and improving retention, we're talking about how we present ourselves, our office, and our treatments. And according to Carl Rogers, who was a very well-known clinical psychologist, according to him, in terms of change and healing, he says that the primary therapeutic conditions for advancing patient healing are congruence, meaning the self-knowledge and the self-awareness of the therapist, as well as their ability to be open, transparent, and genuine with the client. Empathy, the attempt by the therapist to understand the client's moment-by-moment experiences in therapy, and communicating. So understanding and communicating that understanding to the client. And unconditional positive regard. So it's a therapist's ability to have a consistent level of warm regard and respect for the client without imposing any of their own values or needs on the client. And we're going to talk more about that. From a medical or clinical perspective, we're really talking about patient-centered care. Patient-centered care is a huge buzzword these days, and it focuses on the approach being focused on understanding and treating from the patient's perspective. And we know both as clinicians, but also as patients, that when we learn to read our patients, or we feel like our practitioner, we will sense that they understand us, or we understand them, because our responses are appropriate and accurate to what they feel and expect. And it's insight, it's a deep insight, it's a deep feeling that, oh, this person gets me, or oh, this person is listening to me, or oh, I can feel comfortable with this person. So from the patient's perspective, what do they want? They want to be heard. They want to receive clear explanation and instructions about their condition. They want to be treated by staff who show care, concern, and compassion for them. And they want to be treated by staff who are professional in their work. And as a practitioner, our responsibility is then to ensure that all of the information that we give them is easily accessible, that we communicate in a way the patient can understand, that we check the patient's understanding and let them ask questions. We show empathy and understanding, and then we are also open to feedback. So in a way, we're having a conversation with them that is warm, familiar in some way, and at the same time being extraordinarily respectful to them as patients. And this is not new, even though we're talking about patient-centered care as today's modern buzz. Really, this goes back to the Huang de Neijing in the Suen, chapter 39. It says, the most important thing for healing is the relationship of the practitioner, the spirits, and the patient. And the healing process is not just mechanical, that is simply placing of a needle into the skin, but the most important thing for healing is the relationship between the practitioner, the spirits, and the patient. And this relationship begins with the personal attitude and inner behavior of the practitioner. So this is really the foundation of patient-centered care, all the way back to the Huang de Neijing. And it also is the beginning or the intro into improving communication, managing expectations, and then enhancing retention. So what are we talking about? Think about this for just a minute. When we say managing patient expectation, what are we talking about? We're talking about their expectations. It's not necessarily reality. Now, what is real is not necessarily what counts, but it's managing their expectation, that their anticipation or their belief about what is going to be encountered, what's going to happen to them, and then the patient's or the public's mental picture that they will have of the process of interaction with the practitioner and or the system. So they come in with a preconceived idea of what's going to happen. It may be real or it may not. If it's real, that's good. If not, then it's sort of our responsibility to reset that expectation to help them get on the page of that's realistic and plausible, and help them to kind of educate them about what we can and what we can't do. Because remembering that in our Western world, the expectation of what medicine is not necessarily how we function. So we can't just give them a pill and right away they feel better. And specific to facial acupuncture, we can't give a treatment and all of a sudden they've got this pull back tight look. We have to explain to them the process. And I think that many of us understand this in our own clinic and in our own profession, is that there's a lot of education that has to go on in terms of who we are, what we do, and specific to our profession or our quote specialty. When we are managing expectations for you, think about this for a minute. How do you do that? How our patient comes in, they have their quote expectations about what's going to happen. How do you manage that? What do you do to kind of set the playing field in the way that it needs to go in order to both be on board together with that patient, but also to be able to create a good treatment for them in a way that they understand and can receive the benefits of our medicine? So what are those key factors? Communication. Communication is first and foremost, and then helping them to establish trust, right? Because if you communicate clearly, then they trust you, and when they trust you, it helps them to feel more comfortable with you. When you can feel when they're comfortable with you, then you can treat them. And even with the treatments that we provide, there's actually the physical treatment, but there's also the placebo, right? Sometimes just communicating to that patient and having that patient trust you is enough to help them to get better. And when we are communicating, when they're trusting us, we're looking at that consistency of honesty and integrity, because our patients, similar to us, our radar for what's true and what's not true is really heightened, particularly when you're feeling a little vulnerable, when you're not feeling well, and you're putting your health or your well-being into someone else's hands. So if there's a consistency of honesty and integrity, you'll help to establish trust, and the patient will get better. And when we are talking about this kind of consistency of behavior and patient-centered care behavior, we're talking about behavior on so many different levels. We're talking about it in terms of our inner sense of what's right and what's wrong. You know, when you're treating someone, or even when you're talking to someone, you kind of get that little twinge of something's not right here. You know, many times we just ignore it, but really that little twinge has a lot to say. It really is true. And then we're also talking about our behavior related to the direct outside spheres of our influence. So for example, things that our patients may say to us or want us to do, how we interact with our coworkers, our supervisors, even our suppliers, like all of the people that are directly related to us in our work world. And then there's outside of the office too, because remember, you know, our patients are all over the place. And so you see them socially, you see them, you know, at other functions, you see them through the eyes of themselves, but also your patients' peers. So within our professional communities, you see people in public settings and social media. Please do not forget about social media. I think I'm about had it with Facebook because I find that some of the things that people say, professionals say on social media, is so unprofessional. It's just amazing. And so don't think that that's going to go over someone's head or influence how you're seen as a practitioner, particularly in today's world. When you put something or post something on social media, it's there. It does not go away. So when we talk about communication on all of these different levels, and particularly in our practice, we're talking about our written communication, our verbal communication, our actions, and our thoughts. And with regard to all of those, I think we've got a lot of this down. You know, most of us have our intake form, we do our health history, we have a liability waiver. We're pretty good at our report of symptoms for reviewing our candidates, whether they're appropriate for treatment or the treatment itself. I think that we think that we understand our patients, but then, you know, do our patients think that we understand them from their perspective? Sometimes not. The clarity with regard to explaining to them what we can or we can't do, and then our treatment plan. Are we really clear about that treatment plan? You know, the last thing you want to do is start down the road and someone says, oh, well, you didn't tell me that, or, you know, I didn't know that it would take more than 2 treatments. You know, I thought that I would be in and out of here. You know, you need to explain to them that maybe, particularly with facial acupuncture, 10 treatments is where you start, you know, 10 treatments and reevaluate. So what is my treatment and my responsibility and commitment as a practitioner to the patient? And then what is the patient's responsibility or commitment to the practice itself, and the clarity around that, because that can get a little sticky, particularly with our medicine. And then there's our actions, both in terms of our actual treatments, but then our boundaries, our physical boundaries. And then there are thoughts, our mental boundaries, and our judgments. And honestly, I think that the actions and the thought, the unspoken communication, actually bears more weight than what's written or heard. And so when we think about that unspoken language, our actions, our thought, it transpires in so many ways. So think about this. Think about it as you are, and think about yourself, you know, going to someone. If I'm going to my practitioner and they show up in gym clothes, what does that say? Does that say, you know, maybe it's okay, you know, maybe you're going for sports medicine and you know, so gym clothes is appropriate? Well, maybe it's not. You know, maybe if you're working in, say, a high-end or a fancier place and you show up in your gym clothes, well, it doesn't really say much for you, and it doesn't really give you a lot of clout. Also, in terms of your literature. So for me, as a facial acupuncturist, and we'll talk about this in a few minutes, but my patients are coming to me because they don't like the way that they look. But for women in particular, self-image and self-esteem is huge. So I probably won't have magazines in my office or my waiting area that display young, perfect women with gorgeous bodies and perfect faces, because that's going to make my patients feel bad. So I don't think I'm going to do that. If I'm going to ask my patients to disrobe, I'm going to make sure that the lighting is appropriate for that and there's privacy for them. If I want to, if I'm going to touch them, and we touch, you know, in our profession, we touch our patients. So what are the boundaries around that? You know, particularly when you consider the patient's gender, ethnicity, or their personal history. And then I'm also going to be aware of my boundaries. We know this. We know that when we are working with our patients, that there's a power differential. When we're with our friends and our family, the power is equal. So I share something with you, you share something with me, I give you something, you give me something, and it's kind of this expected equal back and forth. But with our patients, they are going to come to us, and the exchange is money. Right? They're going to give me money, and I'm going to, or barter, or whatever you do, and then in exchange, I'm going to take care of them. So that's the exchange. So there's this whole dilemma about, do you make friends with your patients? I don't know. I mean, I don't. It doesn't mean that I'm right or wrong, but it's about respecting that power differential. And then also remembering that the patient's experience is about the patient and not the intent of the practitioner. And I'm not even talking about what we do, but what we think that we're doing. How do we think that we're helping them? It gets a little complicated. And then it also remembering that the patient's treatment time belongs to them and not to you. So here's an example. And I don't know if you do this, but I had to learn the hard way. So a patient, well, let me flip it the other way. I go to someone, a practitioner, and I talk about something. So maybe, my neck tension or my wrinkles in my cheek. Wrinkles. So wrinkles in my cheek or between my forehead, and I start talking about them. And they say, oh gosh, I know, I have that too. Could you look at this? And then they spend the next 5 or 10 minutes talking about them. Well, so what happens? We're all caretakers, right? So for me, I'm going to start taking care of them. I'm going to start being empathetic with them. I'm going to start thinking, yeah, your wrinkles, yeah, I can see it, but no, maybe it's not so bad, or whatever. And then before you know it, I am now the caretaker and they're the patient. And then I'm going to leave and I'm going to feel a little pissed, right? Because I was there to be taken care of, and then that's not what happened. So it's really kind of easy to go off tangent a little bit and talk to you, but just remember, when we are managing these expectations, honoring our patient and improving retention, the last thing you want to do is have that patient go into that 20% where they don't feel heard, they don't feel respected because you spent so much time talking about you as the practitioner. And then those judgment and biases, yours and the patient. So how many of us do personal growth and self-awareness? Because we don't even know sometimes what we're saying or what we're not saying. So when you talk about personal growth, we're talking about that process of the individual becoming aware of oneself in its entirety, followed by taking steps to address the behavior, attitudes, values, actions, and habits that one wishes to change. And then through self-awareness, it's allowing ourselves to see ourselves, or allowing themselves to see themselves honestly, and culminates into targeted changes, resulting in positive outcomes to the life of the individual. So what do you do to take care of yourself and to create more personal growth and self-awareness? Because obviously we're not perfect. None of us are perfect. We all have our issues. We all are going to get hung up somewhere. The key is to know where you're going to fall short. What are the issues, or what are the dilemmas that you have, or that are going to be triggered when your patient comes in and starts talking about them. And then what are you going to do when you have it? Do you just start ignoring them, or do you talk about it, or just kind of smile and say, okay, inside say, all right, my trigger, let me just not get triggered. There was a really interesting study called a personal growth in the medical faculty, and the outcome of that study was, and this is from the physician's perspective, the ability to create a safe space and allow the patients to be is a reflection of the practitioner's professional expertise and personal development. And a physician's effectiveness depends on good communication, cognitive and technical skills used with wisdom, compassion, and integrity. So wisdom, compassion, and integrity. And then it goes on to say that attaining the last attributes, wisdom, compassion, and integrity, requires growth and awareness in management of one's feelings, attitudes, belief, and life experiences. So in this study, there was data that was collected over 12 months from 1994 to 1995, and they did it in terms of mailings. And they asked the healthcare practitioners to please tell us your personal growth stories, by describing one or more experiences of growth in your own self-awareness of your personal history, feelings, assumptions, beliefs, or behavioral responses, for example. And how has that affected you professionally and personally? And the kind of the total outcome of that was that the primary process that promoted personal growth was either a powerful experience that they had or a situation where they were in a helping situation, either them helping somebody else or somebody helping them. And then that leading to this kind of moment of introspection. And how many people have had this? It's kind of like that aha moment where something happens and you go, wow, that was really meaningful. And it kind of shifts the way that you feel about yourself and the world. So in these respondents, one of the experiences that someone had and reported was, without question, the most powerful experience of growth in my own personal awareness came with the dissolution of my first marriage. As a result, I plunged into a several-year quest for personal awareness. As a result, I got to know myself and others a bit better. Professionally, I am now an incredibly empathetic listener for my patients who are distraught over marital and other problems. I don't see them as dysfunctional failures, but rather as often capable people doing their best trying to survive. And I think that's pretty profound. Someone else wrote, I received feedback on a patient interview that my affect was too upbeat, warm, and smiley for the context. In processing this later, it dawned on me that this lady's illness reminded me of an illness I had once, and that my affect was my own way of compensating for the inner fear and anxiety shared by your story. Well, I thought that was pretty good too. So again, we're talking about those subtle, non-verbal things that happen that our patients pick up on, and they kind of value or disvalue or discredit you based on these tiny little things that you may not even be aware of that you're doing. So let's tie this to facial acupuncture. I always think that if you know yourself in relation to your skill set, and in my situation, it's my relationship to aging. So as a practitioner of facial acupuncture and aging, I had to really look at my relationship to aging. How do I feel about aging? And if you ask someone in their 20s and 30s, they have this very philosophical relationship, like, oh, I appreciate the wisdom that comes with aging, and I'm going to be graceful and blah, 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 blah. And then as you, one day, and I don't know if this has happened to some of you, you wake up one day and you look in the mirror and you go, oh, uh-oh, I'm starting to lose my high cheekbones, or where's the definition of my jawline, or I look like my mother, and it's this kind of awakening. And we're going to talk about this too. And so what is that? How do you feel about that relationship to aging? Because when your patients come to you and they talk about aging, you need to, again, step back, understand how they're feeling without it affecting you and your ability to be there for your patient. So I can communicate to my patient. So I have my relationship to aging, but then I also know my skill set. I know, and I can tell them, and this is the communication component of it, that aging is going to happen. It's inevitable. You can't stop it. But with facial acupuncture, we can delay it. We can delay it maybe 5 to 10 years. It's not a tight facelift. It's a healthy, lifted glow. And I don't know if you've seen before and after pictures, but there's definitely a significant change, but it's not a tight facelift. We can help you to look 5 to 10 years younger. So as we age, you're still going to have that 5 to 10 years younger. that a single treatment can yield short-term benefits lasting approximately 3 to 10 days, and a series of treatment averaging 10 to 12 treatments approximately 1 time a week can yield longer benefits, say 4 to 10 weeks. And these benefits can be maintained with maintenance. So there's a series of treatments. The more you do, the better you look. You can, when you're feeling happy with the results, you can come back for maintenance treatment approximately 1 time a month. And I explain this to them in terms of, it's like taking your face to the gym, because people get that. They get, you go to the gym to bulk up your arms, your abs, your legs, whatever it is that you want to tone. You put the work in, you shape your body in a way that you're happy, but you can't just walk away. You can't just stop. You're going to start to lose it, right? So this is like taking your face to the gym. We're going to exercise your face muscles, build that tissue, tighten, lift, and then you need to somehow maintain that on a regular basis. I also know that I have to be honest about these expectations, and to be able to answer those questions, like how many treatments will they take? Like what results can I expect 5 to 10 years? How much younger will I look? Well, so if someone is in their 60s and they want to look like their 25-year-old daughter, not sure I can do that. And you need to be honest about that. Will it hurt? Maybe. You know, we are putting needles in someone's skin, and we are putting them in the face, and we don't really know someone's tolerance for pain. So yeah, it might hurt. And will I get a bruise? Yeah, you might get a bruise. And so as you get more proficient in your skills, you tend to bruise less. But we are putting a needle into the skin, and there are a lot of capillaries and vessels, and there is a chance that you will nick one and get bruised. And then you also need to have the honesty and integrity to know when to treat and when to refer. So, and that's a kind of a more complicated and a longer conversation, so we'll just leave it at that for now. And then I also know that with facial acupuncture, both in terms of diagnosing and understanding and communicating and treating, that we are establishing that relationship on the physical level, the psycho-emotional level, and the spiritual level as well. And I'm doing it through the eyes of Eastern Asian medicine. And I'm really clear. You know, if someone wants that tight pull back, give me an injection, well, I can't do that. I can refer you to someone, but we're really going to look at this through the eyes of Eastern Asian medicine. And what do we mean by that? We mean that when a patient comes in for facial aging and facial acupuncture, they're going to come in with a very common set of symptoms. So on the forehead, they will talk about wrinkles increasing across the forehead, and between the eyes. They'll talk about eyelidtosis. Eyelidtosis is that heaviness of the lid dropping over the eye, wrinkling increasing between the brows and around the eyes, or swelling or darkness under the eyes, on the cheeks and the mouth and the jawline. The cheek area, they'll talk about wrinkling or sagging cheeks, or loss of the nasolabial fold or exacerbation. So that means the nasolabial fold is that crease between the outer edge of the nasal area right here down to the corner of the mouth. It gets deeper with age, and then around the mouth and the jaw lines, there's that creasing or wrinkling around the mouth, particularly what we call the smoker's line, which really doesn't always have anything to do with smoking, because people get them that never had a cigarette in their life. It's just the way that they hold tension in their mouth. Marionette lines. So marionette lines are the lines between the corner of the mouth and the jaw area, or the bottom of the mandible. Mental crease is the horizontal crease between the lower lip and the edge of the chin. And then loss of definition along the jaw area. The neck, skin sagging, platysma banding. The platysma is the large muscle that attaches from the clavicle to the corner of the mouth, kind of scoops up over the neck and it attaches to the corner of the mouth. And as we age, you get banding along the platysma area. And then as a facial acupuncture, people are going to come to you for other things too. They'll come to you for neuromuscular problems, pain-related disorders, anything that's related to the face, Bell's palsy, trigeminal neuralgia, that type of thing. And then they'll also come to you for skin problems, rosacea, acne, hyperdyschromia, sunspots. So they'll come to you for a number of different things. And we'll know that you can honestly tell them that here's what I can do for you. Visibly, we can help to tone that lax skin. We can improve muscle tone. We can soften wrinkles and fine lines. Sometimes we can get rid of them. Sometimes we can just drastically soften them. We can help to even skin texture and color. We can correct or heal those skin problems, and we can enhance overall appearance and visible vitality. And then internally, what we're doing is we're helping to thicken thin atrophic skin that's very flaccid and weak. We can delay that muscle attenuation or the way that muscles of the face age. We can help to stimulate epidermal cell turnover to help improve the skin. We can improve physical, mental, and emotional well-being. And from our medicine, we say that we are harmonizing the meridians, the organs, and the systemic imbalances inside. And then we also will explain to them that they're coming to us for, say, facial concerns, wrinkles, sagging skin, muscle tone, skin dyschromia. But for us, what we're hearing is those are really just the symptoms of something deeper, that underlying pattern of disharmony that we learn about as acupuncturists in our field. So we need to treat the root, that underlying disharmony, with body points, and then we'll treat the branch or their facial concerns with face points. They can be points on the acupuncture points, it can be motor points, it can be a number of other points. And a lot of the points that you choose will depend upon the process of aging or where they are in the different stages of aging. And we learn to visibly recognize those changes over time and then how to adjust them accordingly. And we also know that when we are treating them systemically, we're looking at the paired meridian systems and the organ system attributes. So for us, we're looking at the systems of the heart, the small intestines, the pericardium, the Sanjiao. So when you think about those systems, from their attributes, they deal with the blood vessels. For us, that means complexion. It means fine lines, broken capillaries, rosacea, all of those things. We're going to look at the system of the heart, the small intestine, the pericardium, the Sanjiao. If we are looking at muscle tone or muscle integrity, we're going to look at the system of the spleen and the stomach. As an attribute of these two, we think about muscles, but in our world, what we're talking about is how they age, how they attenuate. Attenuation means they don't get really flaccid. Muscles don't, particularly the muscles of expression, the mimetic muscles, they don't really get weak because we're using them all the time. They get stiff and tight. So that's attenuation. And as we age, we're going to look at the way that they stiffen, the way that they tighten. We want to keep them pliable and their ability to snap back and have the liveliness of them. And we will treat that probably through adjusting the spleen and the stomach system. And then when we're looking at skin quality, texture, pore size, acne, those types of conditions, we'll probably look at the systems of the lungs and the large intestine, because those attributes are controlled by these two systems. And then when we look at the bladder and the kidney, so what is unique about the kidneys and the bladder is aging, the concept of aging, how we age over time. So any type of premature aging, bone fragility, bone resorption, and we all lose bone as we age, and so we look at the kidney system for that. And then a little bit different, in the liver and the gallbladder system, the attributes for that is the ligaments and the tendons. For us, it's more about, because there aren't a lot of tendons in the face, and the ligaments are designed more to connect the horizontal planes and a vertical plane, so the ligaments run more vertically, and then the different layers of the tissue run horizontally. So the ligaments hold things in place, but it's more about muscle contraction, how the smooth flow of muscle contraction. And when muscles contract disjointedly, it causes the skin on top of them to fold and to crease, and that's what creates wrinkles. So wrinkles is oftentimes related to the liver and the gallbladder. So we're going to look at all of those systems in relation to the subset or the set of symptoms that our patients come in with. And we're going to learn how to integrate each of them, because again, we're not just one of these organ systems and meridians, we are a combination of all of them. So we learn as facial acupuncture how to integrate all of these when focusing on our primary concerns, the underlying pattern disharmony, and then adjusting the superficial or the skin and facial conditions that our patients come in with. And then there's the emotional component of it. So in this situation, we look at the wheel of emotions and the Chinese 5 elements. And so we have fire, heart, earth, spleen, metal, lung, water, kidney, wood, liver, and all of the different emotions that go along with it. So when we start talking to our patients about the wheel of emotions, the key is to really ask open-ended questions, and then to listen to what they say, the words that they use, and then mirror back, because they will tell you everything that you need to know. Your patients are really, really good at that. So, and COVID was a perfect opportunity for that. So their socialization skills is related to fire and heart. So we were in lockdown. What did you love the most about being in lockdown? What did you hate the most of it? And listen to them and mirror back their words. The spleen, worry, the earth system. This is about digesting, not just food, but your thoughts. So, and then being in lockdown and being on Zoom all the time, you had to look at yourself. So what was the most, what made you feel insecure about having to look at yourself on Zoom? And just listen to what they have to say. And then with letting go, oh my gosh, how much grief and sadness and letting go was there during this time period? So questions like, what happened to you that made you so sad, that was so painful for you, that was so anxiety provoking or left you in despair? And whatever words they use, mirror back to them. And then fear, how much fear was there during COVID? I mean, all of these emotions, even though, the lockdown period is over, we think, it's still very fresh in our minds. We're still living this. So can you tell me about your fear, how scared you were about this? And then some people jumped into anger. What was the most frustrating, the most the infuriating and irritating thing that you experienced in this? And they'll tell you everything. And then I'm going to listen to what they say, and I'm going to correlate them to those face features. Because with each of the areas of the face, there are specific patterns that show up. So in the kidney and the kidney area, you're going to see things showing up along the ears, the forehead, the chin. In the liver, we're going to see expressions around the eyebrows, the brow bones, and the jaw. The heart, around the eyes, the lines of the lip tips and the corners. And then the spleen, the stomach, we'll see things around the lips, the lower cheeks and above the lips. And then in the lungs will be the nose, the cheekbones, and the moles. And they'll show up. So for example, wrinkles. And this is from the late Lillian Pearl Bridges. And she talks about the physical attributes. And in this this one, we're looking at wrinkles. So with each of the different organ systems, wrinkles are going to appear in different areas. So these little red lines are the wrinkles, and they're appearing within the areas, the kidney, the liver, the pericardium, and the lungs. So all of the areas, you see them colored, and then the wrinkles, both the horizontal and the vertical lines are wrinkles that show up, and they all mean something different. So we would learn about that and be able to see it, and then correlate that with the emotions. Particularly between the eyebrows, the irritation and noise, it decreases those vertical creases that you see between the eyebrows. A lot of people got worse during COVID because of the amount of frustration that there was of not being able to get out of being stuck or whatever it was. Some people loved it, and so they might see more lines here. And then there was a lot of loss, sadness, loss showing up under the eyes, particularly in the lung area, in the cheeks, and then the fear showing up as the lines, the vertical lines around the chin. So all of these, we learn how to read them and interpret them, both on a physical and an emotion and organ level. And then in terms of the spiritual, this is huge in facial acupuncture, because there's this thing that happens, and in our culture, we are not very forgiving, and we do not accept our elders in the way that other cultures do. And so in our Western youth-driven culture, there's this overwhelming urge to erase the visible signs of aging with youth-enhancing procedures. But although we know that our patients are coming in and they're looking for appearance enhancements, there's something else going on. It is much, much deeper. It's not a superficial makeover, but it's a much deeper emotional and spiritual healing. Because at each of our ages, certain things happen. So in our 20s and 30s, we tend to be a little bit more self-involved. Our priorities are more around our social world, maybe starting our career, boyfriends, girlfriends, whatever, and our lifestyle. As we age, our priorities start to shift a little bit, maybe more in careers, maybe you're more interested in starting a family. And then something else happens later in life. We seem to be more established in terms of who we are and our priorities. And then we move into this relationship about aging. It's kind of re-examining and re-evaluating ourselves and hopefully accepting ourselves. And for many, it's a crisis. It happens between your 50s and 60s. And it's this crisis that comes up. It's almost like this existential thing, and some of us may have gone through it, maybe others have no idea what I'm talking about, but it's this moment when you realize that you might be more than half of your life is over. Have you fulfilled your things that you want in life? How are you feeling about your life? Do you feel good about what you've done? Is there too much that you haven't done? And for some people, it's kind of fun and exciting, but then on the other end, for others, it's horrifying. And so when people come in for facial acupuncture, a lot of times what they're really dealing with is that crisis. And so there's a way to treat it. There's the yang component of it and the yin. And as the yang component, for people who are feeling okay about it, you can talk more about it, you can converse, you can treat them, and it's not such a big deal. But then the people who are having a harder time, a lot of the healing comes in just the waiting. You just hold their head. You may throw out a little bone, but then you have to wait, and you have to let them come up with the changes, the self-esteem changes, or the things that are going to help them feel better about themselves. Because sometimes they come because someone told them they had wrinkles on their forehead, and they think, oh my God, I have wrinkles on my forehead. And so they come in. But really, it's more about how do you feel about yourself. And then the yin component of that is really, really a very important component. And so when you have that combination of that yang and that yin, that ability to be practitioner-oriented, to take action, and knowing when to take action, and knowing at your skill set of being what you're doing, and then balancing it with the yin of being more patient-oriented, holding that space, and having that internal sense of being okay with saying nothing. Sometimes it's hard to just say nothing because you feel like, okay, I'm a healer, I need to say something. But sometimes saying nothing is actually more important and more valuable in terms of establishing trust and the patient's healing process. And then it's what we kind of wrapping things up, you know, what goes on in the office and then how that ties into maintaining our patients and bringing in new patients. There's a shift that's going on in our culture right now, and it's a more of a movement into an integrated healthcare system. And as we, Eastern Asian medicine practitioners, as we move into this integrated healthcare system, it's really our responsibility to behave in the manner we wish to be treated. We can't act one way and expect to be treated another way. And that includes, again, the spoken and the unspoken, the way we dress, the way we speak, present ourselves to the world. It's a direct reflection of who we are, how we'll be seen, respected, and treated by other professionals and the public at large, and how people are going to come to us, how we're going to bring people into our office. So fake it until you make it. You know, look and act the part. We know that when a potential client meets you for the first time they meet you, whether it's before you say a word or not, they're going to form an opinion and they're going to set those expectations. And then they're going to come into your office and they're going to look at the presentation. What does my office look like? And from that, they're going to determine the type of treatment. They're perceived, right, managing expectations. They're going to come up with an expectation of what am I going to get? A luxury treatment, a relaxation. Is this strictly clinical? Is this a specialized practice? And then, hard to believe it, but it certainly is true, your voice, the way that you communicate and the words that you choose are going to reflect your level of experience and your degree of education. And that's how they're going to set their expectations of you. And then it becomes your responsibility to manage those. Because we know, and it's so true, that even though patients may come to you for what you do, they're going to stay with you for who you are. And that staying is going to revolve around our integrity, our honesty, and our ability to be trustworthy. So I'm going to just open this up for questions, but I just want to tell you that for those of you who are really interested in facial acupuncture and learning more about it, I have joined forces with the Pacific College of Health and Science to create a program called Facial Applications for Cosmetic Enhancement, or the FACE program. And it's over 140 hours of virtual and hands-on training. And rather than it being one person, it's a combination of today's leaders in the field. And also in terms of all of this, we will all be giving presentations virtually. And then when we meet for a clinical time, they will be there to offer hands-on experience and mentorship. Through the school, we have financial aid available. The classes begin in January. And if you are interested in learning more about it, there is a free information session tomorrow, 5 p.m. Eastern time, 2 p.m. Pacific time, and here's the link, and I think that's going to go into the chat. And that's it. So thank you. So I'm going to turn off the presentation and then join you and answer any questions that you might have.
All right, Shellie, I am here with you. So if you come back to the Chrome tab, you should see us.
Okay, let me get there. Hold on, this was...
Of course. I took the slides down, so right now they're looking at us.
Okay. Oh,
there we are.
I did it.
All right, well, thank you so much. That was really incredible. And I know that everybody here was really, really interested in what you had to say. We do have a couple questions here, so let's get to those. How much time do you suggest between each of the first 10 treatments?
Good question. So there's a whole protocol of how to determine that, but in general, once a week. So for someone's younger, they may be able to hold it for up to 10 days. If someone's older, you may want to ramp it up a little bit. But I'm going to say on average once a week, but it also depends upon the patient too, because if the patient, and this just kills me, they come in and they say, okay, in 5 weeks, my daughter's getting married and I need to look my best. No, I'm going to come 5 times a week. And I'm like, no, the healing happens in between the sessions, not just during the session. So you have to manage expectations. What are they expecting? How fast can you do it? And then, but you can do it once a week, twice a week, maybe 3 times a week. I do have patients that have flown in from other states or countries and they just can't stay. So you ramp it up, but once a week, twice a week.
All right, so this next question is a really wonderful question. So what are the self-awareness strategies for practitioners who simply lack experience working with different skin types? So diagnosing on darker skin tones can be problematic, and what can they do to be better so the patient does not leave feeling ignored and or misdiagnosed?
Yeah, good question. Thank you so much. And this is where education occurs. So first, just learning. And in the training programs, we look at faces and look at faces and look at faces and look at faces until you can train your eye to see the subtleties. Even when you were looking at the wrinkles in the face, you don't always see them initially. Towards the end, it becomes almost your professional deformation because you'll never look at a face the same way again. But it's practice. It's just practice, 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 practice. Practice in the beginning to train your eye, and then practice over time to, again, be able to see the subtleties of it.
Wonderful. Let's just take a quick peek at the chat and see if we have any more questions here. It looks like that actually might be it for questions tonight. So I just want to thank every person for attending. There is a link in the chat, which will get you to go to the webinar tomorrow night. That's going to give you more information on the FACE program with Shellie and the Pacific College. Shellie, it is always a pleasure to host you. Really nice to see you. And we want to thank everybody for coming.
Thank you so much. It's always a pleasure to be with you and to be with Lots. It's such a treat for me too. So thank you, thank you, thank you. Really, really, really appreciate it.
All right. Well, everyone have a good night. And Shellie, we'll see you next time.
Okay. Thank you. Okay. Bye.